Just a minute. Order number 11, sir. In the name of the Honorable Leader of the Senate, to move the second reading of the Dematerialization of Government Securities Bill 2018.
Thank you, Mr. President. Before I commence debate on this bill, I would like to seek the Honourable Senate's permission to have a cognate debate. The items on the order paper 11 through 15 are all intricately related, and I would like to first of all seek the Senate's permission to proceed with a cognate debate on these matters.
It has been proposed, and I move that the items 11 to 15 on the order paper be discussed together. All those honorable members in favor, please say aye. Aye. Those opposed, please say no. I think the ayes have it. Please proceed.
Thank you, Mr. President. And this matter flows quite naturally from the previous debate in terms of the restructuring of the debt and simply the dematerialization of the government securities. Is just simply, as I understand it, to convert from a paper-based system of certificates for securities or instruments to an electronic or digital system. And this has been going on. I believe it has commenced in the central bank. And I believe as far back as August 2011, a task force was established under the central bank looking at the specific matter of converting all government securities to this form, to this electronic form. It is felt that it is not really a new system. I believe in 2010, we said that most traders globally were using this electronic form of government security and various securities. It's said that it is a seamless and secure system, and issues that we normally face in our jurisdiction, including persons who have misplaced or lost their certificates, the paper certificate occurred previously, and also we've had situations where they have been stolen, and indeed with persons have tried to make changes on them. It is felt that this system is quite secure, and in terms of the actual debt restructuring, it is proposed by this bill to, bear with me, Mr. President, to move the process along as it relates to government's instruments, security instruments. And if we may go to the bill, it gives the definitions, of course, and it speaks also to the issue which I spoke about in terms of security. Of note, however, in Clause 5, it speaks of a register who, for the purposes, will be, in our situation, the Central Bank of Barbados. And there's where the information will be kept. On 5.2, we see the records which the register will be responsible for in terms of these instruments. The name and address, the principal value, the interest to be repaid, the right accruing from the dematerialized government securities, the rights of third parties. Another example, I believe, is the fact that persons who hold these securities will have access, have the ability to daily almost have access to see what is happening in terms of trading. For example, they want to trade in their instruments at any particular time. All in all, that is fairly straightforward. In terms of the local loans, and of course, the other bills speak to the issue conversion in terms of the savings bonds, the treasury bills, and indeed in terms of the application of this to local loans. Of importance, however, in the local loans, this speaks to the whole issue of the limits, the local limits. We know about the debt restructuring, and assuming that the exchange offer is executed, there's 100% participation, which we now expect. It will mean that approximately $3 billion in debt will be shifted to government's longer-term debt portfolio. And in accordance, I understand, with the Local Loans Act, Cap 98, which was amended in 2016, the Minister responsible for finance may borrow sums not exceeding $7.5 billion in the aggregate. At this point in time, as of July 2018, approximately $5.8 billion had been utilized. Clearly, if $3 billion is needed, the statutory limit will be surpassed. And to accommodate the restructured portfolio and to facilitate space for new borrowing if it becomes necessary, it is proposed that the limit be raised to $10.5 billion. Members might be aware that there is normally a sinking fund. And traditionally, government's debentures had a bullet repayment structure whereby the principal will be paid in a lump sum. It was a requirement that in the legislation for the establishment of a sinking fund to assist in offsetting these bullet payments when necessary. And specifically, it was required that 2% of the debentures were earmarked, the value of the debentures would earmark every year to be put in this sinking fund to be held. Consequently, as a result of the debt restructuring, a new series of instruments has been obviously been proposed, which will carry out an amortizing structure, which we discussed in terms of the time it will now take and the ability for persons to draw down the principal as well as the interest from time at certain periods. So now the principal will be paid over an extended period. The requirement for this sinking fund is reduced. And in this context, it is proposed that the sinking fund legislative was recorded at $4.7 billion. It is being recommended that this will now be reduced. It will now reduce to $1.75 billion. Mr. President, in a nutshell, I believe I've covered the salient points in these 5 bills. And I now beg to move that the dematerialization of Government Securities Bill 2018 be now read a second time.
Move that the bill under consideration be now read a second time. All honourable members in favour, please say aye. Those against, please say no. I think the ayes have it.
Mr. President, I beg to move that Your Honour do not leave this chair and the Senate resolve itself in committee for further consideration of this bill.
The motion is that I now absent myself and that resolve ourselves into committee for the further consideration of this bill. All honourable members in favour, please say no. Aye. Aye, sorry. I think the ayes have it.
The House is now in committee.
Part 1, clauses 1 to 3.
The question.
Part 1, clauses 1 to 3.
Mr. Chairman, I beg to move that Part 1, clauses 1 to 3, stand part.
The question is that clauses 1 to 3 stand part. All honourable senators in favour, please say aye. Those against, please say no. Methinks the ayes have it.
Part 2, clauses 4 to 6.
Mr. President, I beg to move that clause 2, That part 2, clauses 4 to 6, stand par, do stand par.
The question is that Part 2, clauses 4 to 6, stand par. Honourable senators in favour, please say aye. Those against, please say no. Methinks the ayes have it.
Part 3, clauses 7 to 9.
Mr. Chairman, I beg to move that part 3, clauses 7 to 9, stand par, do.
The question is that Part 3, clauses 7 to 9, stand par. All honourable senators in favour, please say aye. Those against, please say no. Methinks the ayes have it.
Part 4, clauses 10 to 12.
Mr. Chairman, I beg to move that part 4, clauses 10 to 12, stand par.
The question is that Part 4, clauses 10 to 12, stand par. All honourable senators in favour, please say aye. Those against, please say no. Methinks the ayes have it.
Schedule.
Mr. Chairman, I beg to move that the schedule be the schedule to this bill.
The question is that the schedule be the schedule to the bill. Honourable senators in favour, please say aye. Those against, please say no. Methinks the ayes have it.
Mr. Chairman, I beg to move that you do not report to His Honour the President the passing of one bill in committee.
The question is that I do now report to His Honour the President the passing of one bill in committee. Honourable senators in favour, please say aye. Those against, please say no. Methinks the ayes have it.
The chairman of the committee has reported to me the passage of the bill under consideration in committee.
Mr. President, I beg to move that this bill be now read a third time.
It is being moved that the bill under consideration be now read a third time. All honourable members in favour, please say aye. Those against, please say no.
No.
The ayes have it. No division has been called for. No need to come individually.
Calling for division, well, Adi pass.
Mr. President, I beg to move that this bill do not pass and be cited as the dematerialization of Government Securities Bill 2 Act 2008.
Has been moved that the bill under consideration be now read a third time and be so cited. The record, it might be my error. What's the record? You have a way of getting it? It says both of what you said. Do you have any means of checking the record?
Let's do it again.
That the bill so passed. So
We have to do it 5 times.
Okay. So which one are you reading?
The first one.
the materialization.
Which one is reading?
Mr. President, I beg to move that this bill do not pass and be cited as the Dematerialization of Government Securities Act 2000.
Call for divide.
Move that the
You can't talk
bill under
about
consideration will now pass and be so cited. Does that satisfy you, Mr. Clark?
He asked for divide.
I had called for divide, Mr. President, sir.
I'm not sure that, are you sure you weren't late in that?
Well, if that is the determination, I will do it.
I thought I did hear you, but I think we had moved beyond that, and that might have been signaled by the clerk.
No issue, Mr. President. No issue, Mr. President. You could take it on a majority, Mr. President.
No.
In the name of the Honourable Leader of the Senate, to move the second reading of the Local Loans Amendment Bill 2018.
Mr. President, this bill was covered in the cognate debate, and I beg to now move that this bill be now read, that the Local Loans Amendment Bill 2018 be now read a second time.
That the Local Loans Amendment Bill be now read a second time. All those,
No? Oh, okay. Can't speak.
Can't get up and speak. I dealt with everything that you can get. It was cognate debate. You can't debate on everything.
The reason for having it as a cognitive debate is that you have one speech and everyone speak.
to the extent that it was a cognate debate, once the second reading is completed, then you can't be addressing the individual bills as they come up. It was indicated at the outset we were dealing with everything together, all the bills, and so related, all first cousins of one another, that we would have one general debate. So now, having agreed to that and having done that, we can't now have them being dealt with individually still. We gave up our right to treat them individually when we decided on a cognate debate. I think that's appreciated.
So we are
So you can go ahead.
local.
I haven't done it yet. Mr. President, I beg to move that Your Honor do not leave the chair and the Senate resolve itself in the committee for further consideration of this bill.
I do now leave the chair. And then on the consideration of those amendment bill we discussed in committee.
The House is now in committee.
Clause 1.
Mr. Chairman, I beg to move that Clause 1 stand part.
The question is that Clause 1 stand part. All honourable senators in favour, please say aye. Those against, please say no. Methinks the ayes have it.
Clause 2.
Mr. Chairman, I beg to move that Clause 2 stand part.
The question is that Clause 2 stand part. Honourable senators in favour, please say aye. Those against, please say no. Methinks the ayes have it.
Clause 3.
Mr. Chairman, I beg to move that Clause 3 stand part.
The question is that Clause 3 stand part. Honourable senators in favour, please say aye. Those against, please say no. Methinks the ayes have it.
Clause 4.
Mr. Chairman, I beg to move that Clause 4 stand part.
The question is that Clause 4 stand part. Honourable senators in favour, please say aye. Aye. Those against, please say no. Methinks the ayes have it.
Mr. Chairman, I beg to move that you do not report to His Honour the President the passing of one bill in committee.
The question is that I do now report to His Honour the President the passing of one bill in committee. Honourable senators in favour, please say aye. Aye. Those against, please say no. Methinks the ayes have it.
The chairman has reported the passage of the Local Loans Amendment Bill in committee.
Mr. President, I beg to move that this bill be now read a third time.
Call for divide.
It has been moved that the bill under consideration be now read a third time.
I will need to call for divide. Oh, wait, I'm with you. In terms of, yeah, sorry, retract the call to make the call at the passing stage. Yeah. I learning, man, or?
Mr. President, I beg to move that this bill do not pass and be cited as the Local Loans Amendment Act 2018.
Call for divide.
Move that the bill under consideration be now read a third time.
Call for divide, sir. Call for divide, Mr. President.
Well, the division has been called for. I think you already have our names now in order. Yes.
I know, because we didn't have no other.
Senator Walker?
Aye.
Senator Moore?
Aye.
Senator McConney?
Aye.
Senator Springer?
Aye.
Senator Grant?
Aye.
Senator Holder?
Aye.
Senator Cummins?
Aye.
Senator Haynes?
Aye.
Senator Sands?
Aye.
Senator Franklin?
No.
Senator Drapes?
Nay.
Senator Wiggins?
Abstain.
Senator Boyce?
The record is
Abstention.
here. Abstain.
Abstention from Senator Boyce.
Senator Maxwell? Senator Tate?
Abstain.
Senator Maynard? Senator Nurse? Your Honor, Senator Greenwich?
Aye.
President, the results of the division. 10 honorable senators voted in favor of the motion. 2 honorable senators voted against. And there were 6 abstentions. So, motion is passed.
Bill is passed and is so seconded.
Order number 13, in the name of the Honourable Leader of the Senate, to move the second reading of the Savings Bonds Amendment Bill 2018.
Mr. President, I beg to move that Saving Bonds Amendment Bill 2018 be now read a second time.
All those in favor? The question is that the Saving Bond Amendment Bill 2018 be now read a second time. All those in favor, please say aye. Aye. Those against, please say no. No. I think the ayes have it.
Mr. President, I beg to move that Your Honor do not leave the chair and the Senate resolve itself into committee for further consideration of the bill.
The Senate is now in committee. Clauses. Go on.
Tell you about earlier.
How much you got?
Clause 1.
Mr. Chair, I beg to move the Clause 1 stand part.
The question is that Clause 1 stand part. Honourable Senators in favour, please say aye. Aye. Those against, please say no. Methinks the ayes have it.
Clause 2.
Mr. Chairman, I beg to move that Clause 2 stand part.
The question is that Clause 2 stand part. Honourable Senators in favour, please say aye. Those against, please say no. Methinks the ayes have it.
Clause 3.
Mr. Chairman, I beg to move that Clause 3 stand part.
The question is that Clause 3 stand part. All honourable senators in favour, please say aye. Aye. Those against, please say no. Methinks the ayes have it.
Clause 4.
Mr. Chairman, I beg to move that Clause 4 stand part.
The question is that Clause 4 stand part. Honourable senators in favour, please say aye. Aye. Those against, please say no. Methinks the ayes have it.
Clause 5.
Mr. Chairman, I beg to move that Clause 5 stand part.
The question is that Clause 5 stand part. Honourable senators in favour, please say aye. Aye. Those against, please say no. Methinks the ayes have it.
Clause 6.
Mr. Chairman, I beg to move that Clause 6 stand part.
The question is that Clause 6 stand part. Honourable senators in favour, please say aye. Those against, please say no. Methinks the ayes have it.
Clause 7.
Mr. Chairman, I beg to move that Clause 7 stand part.
The question is that Clause 7 stand part. Honourable senators in favour, please say aye. Those against, please say no. Methinks the ayes have it.
Clause 8.
Mr. Chairman, I beg to move that Clause 8 stand part.
The question is that Clause 8 stand part. Honourable senators in favour, please say aye. Those against, please say no. Methinks the ayes have it.
Clause 9.
Mr. Chairman, I beg to move that Clause 9 stand part.
The question is that Clause 9 stand part. honourable senators in favour, please say aye. Those against, please say no. Methinks the ayes have it.
Mr. Chairman, I beg to move that you do not report to His Honor the President the passing of one bill in committee.
The question is that I do now report to His Honor the President the passing of one bill in committee. Honourable senators in favour, please say aye. Aye. Those against, please say no. Methinks the ayes have it.
The chairman has reported to me the passage of the Saving Bond Amendment Bill 2018 in committee.
Mr. President, I beg to move that this bill be now read a third time.
The question is that the bill under consideration be now read a third time. All those in favor, please say aye. Aye. Those against, please say no. I think the ayes have it.
Mr. President, I beg to move that this bill do now pass and be cited as the Savings Bond Amendment Act, 2018.
Question is that the bill under consideration be now read, be now passed and be so cited.
Call for division, Mr. President.
All those in favor?
The clerk ain't got that up. There's only one clerk, the other guy is sick.
The next one.
I think I find a way though. Yeah.
Senator Walker.
Aye.
Senator Moore.
Aye.
Senator McConney. Aye. Senator Dr. Springer.
Aye.
Senator Grant.
Aye.
Senator Holder.
Aye.
Senator Cummins.
Aye.
Senator Haynes. Senator Sands.
Aye.
Senator Franklin.
No.
Senator Drake.
Nay.
Senator Wiggins. Senator Boyce.
Abstention.
Senator Reverend Maxwell. Senator Tate.
Abstention.
Senator Maynard. Senator Nurse. His Honor Senator Greenwich.
Aye.
Mr. President, the results of the division: 10 honorable senators voted in favor of the motion, 2 honorable senators voted against, and 6 honorable senators abstained.
The bill is passed and be so cited.
Order number 14, in the name of the Honourable Leader of the Senate, to move the second reading of the Treasury Bills and Tax Certificates Amendment Bill 2018.
Mr. President, I beg to move that the Treasury Bills and Tax Certificate Amendment Bill 2018 be read a second time.
Question is that the bill under consideration be now read a second time. All honorable members in favor, please say aye. Aye. Those against, please say no. No. I think the ayes have it.
Mr. President, I beg to move that Your Honor do now leave the chair and the Senate resolve itself into the committee for further consideration of this bill. The question is.
The question is that I do now leave the chair and that the Senate resolve itself into committee for further consideration of this bill.
The Senate is now in committee.
Clause 1.
Mr. Chairman, I beg to move that Clause 1 stand part.
The question is that Clause 1 stand part. Honourable Senators in favour, please say aye.
Aye.
Those against, please say no. Methinks the ayes have it.
Clause 2.
Mr. Chairman, I beg to move that Clause 2 stand part.
The question is that Clause 2 stand part. Honourable Senators in favour, please say aye.
Aye.
Those against, please say no. Methinks the ayes have it.
Clause 3.
Mr. Chairman, I beg to move that Clause 3 stand part.
The question is that Clause 3 stand part. Honourable Senators in favour, please say aye. Those against, please say no. Methinks the ayes have it.
Clause 4.
Mr. Chairman, I beg to move that Clause 4 stand part.
The question is that Clause 4 stand part. Honourable Senators in favour, please say aye.
Aye.
Those against, please say no. Methinks the ayes have it.
Clause 5.
Mr. Chairman, I beg to move that Clause 5 stand part.
The question is that Clause 5 stand part. Honourable Senators in favour, please say aye.
Aye.
Those against, please say no. Methinks the ayes have it.
Clause 6.
Mr. Chairman, I beg to move that Clause 6 stand part.
The question is that Clause 6 stand part. Honourable Senators in favour, please say aye. Those against, please say no. Methinks the ayes have it.
Clause 7.
Mr. Chairman, I beg to move that Clause 7 stand part.
The question is that Clause 7 stand part. Honourable Senators in favour, please say aye. Those against, please say no. Methinks the ayes have it.
Mr. Chairman, I beg to move that you do not report to His Honour the President the passing of one bill in committee.
The question is that I do now report to His Honour the President the passing of one bill in committee. Honourable Senators in favour, please say aye. Aye. Those against, please say no. Methinks the ayes have it.
Sir.
The chairman has reported to me the passes of the bill currently under consideration in committee.
Mr. President, I beg to move that this bill be now read a third time.
The question is that the bill under consideration be now read a third time. All honourable members in favour, please say aye. Aye. Those against, please say no. I think the ayes have it.
Mr. President, I beg to move that this bill do now pass and be cited as the Treasury Bills and Tax Certificates Amendment Act 2018.
Question is that this bill under consideration be now passed and be so stated. Honourable members in favour, please say aye. Aye. Those against, please say no. I think the ayes have it.
Order number 15, sir. In the name of the Honourable Leader of the Senate, I move the second reading of the Local Loans Amendment number 2, Bill 2018.
Mr. President, I beg to move that the Local Loans Amendment number 2, Bill 2018, be now read a second time.
It has been moved that the Local Loan Amendment Bill number 2 be now read a second time. All those honourable members in favour, please say aye. Aye. Those against, please say no. I think the ayes have it.
Mr. President, I beg to move that Your Honour do now leave the chair and the Senate resolve itself into committee for further consideration of the bill.
The motion is that I do now leave the chair and that the Senate resolve itself into committee for further consideration of this bill. All honourable senators in favour, please say aye. Aye. Those against, please say no. I think the ayes have it.
The Senate is now in committee.
Clause 1.
Mr. Chairman, I beg to move that Clause 1 stand part.
The question is that Clause 1 stand part. Honourable Senators in favour, please say aye.
Aye.
Those against, please say no. Methinks the ayes have it.
Clause 2.
Mr. Chairman, I beg to move that Clause 2 stand part.
The question is that Clause 2 stand part. Honourable Senators in favour, please say aye.
Aye.
Those against, please say no. Methinks the ayes have it.
Clause 3.
Chairman, I beg to move that clause 3 stand part.
The question is that clause 3 stand part. Honourable senators in favour, please say aye. Those against, please say no. Methinks the ayes have it.
Clause 4.
Mr. Chairman, I beg to move that clause 4 stand part.
The question is that clause 4 stand part. Honourable senators in favour, please say aye. Those against, please say no.
On this point, Mr. Sub-Chair, I consider the previous amendment that was done under the Local Loans Act amended Section 4 of Cap 98 to delete the words 5 million. I thought I was. Okay. So we stand in committee then. Okay. My apologies, Mr. Deputy President. The previous amendment to the Local Loans Amendment Act, or the Local Loans Act that was done in 2012, Section 4 was amended by deleting the words 5 billion, and substituting it with 6.5. The proposed amendment, if we could have some discussion, please, in terms of the draft which is before, there doesn't seem to be a reference to the quantum. Where are the local loans? Okay. But that was the trend?
I think what he said. No, this is a different bill. Yeah. The first one, there are two. This deals with the dematerialization for this.
All right, I'm guided. Thank you, Mr. President. I'm with you.
So we were on the
Clause
4.
Thank you. Chairman, I beg to move that clause 4 stand part.
The question is that clause 4 stand part. Honourable senators in favour, please say aye.
Aye.
Those against, please say no. Methinks the ayes have it.
Clause 5.
Mr. Chairman, I beg to move that clause 5 stand part.
The question is that clause 5 stand part. Honourable senators in favour, please say aye.
Aye.
Those against, please say no. Methinks the ayes have it.
Clause 6.
Mr. Chairman, I beg to move that you do not report to his own.
Clause 6?
Oh, sorry.
Six clause.
Mr. Chairman, I beg to move that clause 6 stand part.
The question is that clause 6 stand part. Honourable senators in favour, please say aye.
Aye.
Those against, please say no. Methinks the ayes have it.
Mr. Chairman, I beg to move that you do not report to His Honour the President the passing of one bill in committee.
The question is that I do now report to His Honour the Speaker the passing of one bill, the President, the passing of one bill in committee. Honourable senators in favour, please say aye. Those against, please say no. Methinks the ayes have it.
Exhausted.
The chairman has reported to me the passage of the bill currently under consideration in committee.
Mr. President, I beg to move that this bill be not read a third time.
The motion is that the bill under consideration be now read a third time. All those honourable members in favour, please say aye.
Aye.
Those against, please say no. I think the ayes have it.
Mr. President, I beg to move that this bill do now pass and be cited as the Local Loans Amendment Number 2 Act 2008.
It has been moved that the bill under consideration be now passed and be so cited. All honourable members in favour, please say aye.
Aye.
Those against, please say no. I think the ayes have it. The next one, Joe.
National Insurance Number 9.
Order number 9, sir. In the name of the Honourable Leader of the Senate, to move the second reading of the National Insurance and Social Security Amendment and Validation Bill 2008.
National Insurance and Social Security Act.
Thank you, Mr. President. Mr. President, on June the 11th of this year, the Honourable Prime Minister, in her budgetary proposals and financial statement, spoke about some revenue-raising measures at that time. And she spoke in terms of the health services of Barbados, in terms of the Queen Elizabeth Hospital, and in terms of the Accident and Emergency Department and the polyclinic system. I believe it was coming certain pledges we had made in our manifesto in terms of reducing the waiting time in Accident and Emergency Department, and certainly in moving our polyclinics to opening 24 hours a day, in a move to address some of the long delays and the pile-ups in terms of patients at the Accident and Emergency Department. I should indicate at this point in time that in fact it was an extension of a process in terms of the polyclinic system that had started in 2006 with extended opening hours at the Morris Bayer Polyclinic and indeed at the Polyclinic in Oistins. Persons who came afterwards, parading as government, had pledged in their manifesto to extend opening hours at all polyclinics across Barbados 24 hours a day. But indeed, nothing had materialized. And so it was as though we were continuing a process where there had been a halt in the past 10 years. She spoke at that time to, I believe it was allocating $3 million to the polyclinics in terms of upgrades that would be necessary for 2 polyclinics to extend their opening hours, and indeed committed $11 million for an expansion process at the Accidents and Emergency Department. In addition, she spoke about a health service contribution of 2.5% of insurable earnings to be collected by the National Insurance Board on behalf for the purposes of the Queen Elizabeth Hospital. I think some honourable members would be aware of the cost of operating the Queen Elizabeth Hospital can run to over $200 million some years. And it has been a problem in terms of financing hospital care, but I know globally there has been a plan over years at looking at in terms of healthcare costs and how we can reduce them, or indeed engage the population in playing part of these costs. The previous regime had introduced the pharmaceutical cost where you paid for your prescriptions. And I know that there was talk about health insurance. And indeed for years there have been discussions with private sector, with the national insurance in terms of a national insurance health levy, etc. This has been going on for years, and it is something that has to be addressed. I think my honourable colleagues who work for years at the Queen Elizabeth Hospital, who sit here in this honourable chamber, will be aware of a number of the problems and issues that have occurred in terms of the Queen Elizabeth Hospital over time in providing health care to Barbadians. Over the years, both governments have been committed to the issue of delivery of health care free at point of delivery. The hospital was opened in 1964, and since then that has been the trend. However, the hospital of 1964 compared to that of 2018 is a completely different thing in terms of the services and the variety of services and high-class care that is available. And this is still being provided free. I believe I stand subject to correction, but I would I would both say that I believe in the Eastern English-speaking English Caribbean, indeed the French, Barbados is perhaps the only country where you could have bypass surgery without paying for free. And indeed, joint replacement surgery and stuff like this for free. But as I said, over time, you get rising costs, increasing services. I can speak to some of them. I believe the Honourable Senator Tate, her father was very instrumental in us having a cardiac unit. And again, providing care free of cost, generally to Barbadians. Their services, Senator Maynard will be well aware of the advances in terms of surgery, in terms of ENT surgery, where they've moved away from the old tedious long incisions and where they're using all sorts of fancy equipment at this point in time. Still free. And of course, it has a cost. And the costs have been rising over the years. And the QH over both administrations in terms of coming to grips with this rising cost and trying to determine what is the balance in terms of services that can be provided and those, what is your wish list and what you can really economically provide. This measure, I believe, is not, in terms of solution, not intended to be find the solution in terms of provision and financing of healthcare at that institution. It is a government coming in and finding a hospital, owing millions of dollars to suppliers, not only in terms of pharmaceuticals, in terms of foodstuffs, and in terms of equipment which is needed. And of course, items like gloves, sterile dresses, stuff like that. And of course, malfunctioning equipment. And this is a government trying to quickly try to add some assistance to the Queen Elizabeth Hospital. I know my colleague, Senator Maiden, might be of the opinion that it is felt that the provision of this levy is just a means for the government to divert $45 or $15 million away from the consolidated, not having to bring it out of the consolidated fund, but as some would say, further impose it on the people of Barbados. But I see it differently. I see it as a partial sort of process. And no doubt we will see when we get to the process of budgeting for health care and for the hospital. I have no doubt that he will certainly change his opinion. In a nutshell, that's it. We have a Queen Elizabeth Hospital providing greater, wider services, faced with problems of equipment shortages, equipment malfunctioning, shortages in drugs from time to time, issues with sterilization, and a crowded accident in the emergency department. So we've addressed it. We want to divert some of the patients towards the polyclinic system. In terms of the discussion of the expansion of the accident emergency department, I believe it is to speak in terms of having expanded facilities, in terms of the stat room for emergency, life-threatening emergencies, in terms of utilizing the area upstairs in having a sort of review system. Oftentimes beds are held up for hours while patients wait in the A&E on beds for registrars and sometimes consultants from various specialties to come and review them. And it creates a further bottleneck. It is expected that patients who are going to be reviewed, who have had initial treatment, could be put in this area called observation. In addition, they're moving towards a triage system where the triage will be taken over by medical practitioners who will assess patients when they arrive, determine the priority in terms of the urgency of the need for care. And indeed, if they need to be treated at the A&E department or if they can be seen at the polyclinic, the fast track or wherever. So these are all plans that are going on now. As I said, $14 million in all has been allocated. It is a situation where government recognizes it has a duty to the people of Barbados in terms of providing them all in trying times with the best possible health care. And in doing this, they're asking persons to contribute, to pay a part via the national insurance. Some might wonder why the national insurance and not the consolidated fund. And I believe most of you know the answer. Indeed, the most recent example of this was the NSRL, which introduced initially to provide for the hospital and indeed to provide garbage trucks. The garbage trucks have not yet arrived, and the QEH ended, rather than receiving funds from the NSRL, ended having to pay additional taxes because of the NSRL. We have had a situation in the past, I believe, when I read that in the 70s, there was a health levy, but it was going into the consolidated fund, and certainly the funds for health weren't all coming back to health. And I think those of you who are familiar with the system would know that once in the consolidated fund, it can be highlighted for a certain area, but it doesn't follow that necessarily it will be utilized in that area depending on the circumstances and the demands of government's finances. So this is meant to create, I can't say secure, in terms of the National Insurance Board establishing an account, a special account, where it is expected that the funds deducted will be in this account for the use of the Queen Elizabeth Hospital. In terms of the actual contribution, it is anticipated that it will be 2.5% of insurable earnings, where the employer will contribute 1.5% and the employee 1%, and of course, and also self-employed persons, effective October 2018. Before some of my honorable colleagues start jumping from the ceiling about the date of October the 1st, I would like to say that this matter was laid in the other chamber on the 26th of September, with the understanding that the Senate would have debated the matter on the 27th. They were then informed that the Senate had been adjourned until the 17th of October. So obviously, it could not be debated before the 1st in the Senate. There is no magic, there is no rudeness, there's no sleight of hand or no man to insult, but it was to go to the Senate, but the Senate was not sitting. So they've had to do a validation in terms of the process, because the date of implementation is the 1st of October, based on the budgetary statement of the Prime Minister on June the 10th. In terms of the actual bill, I believe there is an amendment that is going to be proposed in the schedule. And if I may, Mr. President, page 6, it says consequential amendments in terms of the National Insurance and Social Security Self-Employed Persons Regulations 1970. In the first schedule, it said to delete the words 15.5% and substitute the word 16.5%. That is the 1% increase. I have been reliably informed that this is an error by the Honourable Leader of the Opposition in this chamber, that it should be in fact 16.1, sir? And then obviously it would go to 17.1. Mr. President, I don't want to delay the chamber. I know that there are many members in this honorable chamber who are arraying to participate in this debate, be it in terms of health care, be it in terms of the National Insurance Board, or indeed in terms of the viability and sustainability of the national insurance. And with those few words, Mr. President, I beg to move that this bill be now read a second time.
The question is that the bill under consideration, namely the amendment to the National Insurance and Social Security Act, be now read a second time. I recognize...
Thank you, Mr. President. I am not going to delay the Senate too long. I just want to thank Brother Senator Walker. I almost call him Comrade Walker, but I forgot. For making this amendment, because this speaks to the rush job that will be made. this speaks to the rush job that we're not taking our time and going through these things properly, right? But that is not the only problem we have with this thing. The proposed increase came about in the budget. The budget is done under what the Provisional Collection of Taxes Act, which gives the Minister of Finance the power to levy a new tax or to raise any existing tax. And you can do that within 4 months. You have 4 months in which to bring the legislation to the House. So if the minister had said, well, we're going to increase national insurance by 1%, then by 4 months after that, legislation should have been here to regularize that situation. Otherwise, you will be taking people's money without a law being in place to do so. I know Senator Gwyneth will be concerned that I'm saying they're breaching the Constitution, but they are. It is unconstitutional to take money without due process of law, without having a law in place. And there's no law in place today that would have allowed you to take money from anybody from the 1st of October. And people have already taken money. And it has, out of people's salaries, for the people who work the first week in October, second week in October, they have already paid at the higher rate. There's no law in place to do so. The minister, as I said, can raise a tax. But this also does not qualify as a tax for the purposes of the Provisional Collection of Taxes Act. If you look at the definition of the provisional in the Act itself, at Section 2, it says, tax includes all assessments, charges, duties, fees, rates, impositions, and other levies, however called, the proceeds of which are payable into the consolidated fund as part of the revenues of Barbados. So for the purposes of the Provisional Collection of Taxes Act, you must pay this money into the consolidated fund, or you're in breach of this act. This act says the national insurance collects it, not the consolidated fund, and pays it into the hospital, not the consolidated fund. So this does not qualify to be a budgetary measure in accordance with the Provisional Collection of Taxes Act. The act itself, so this has to be a new act, and so you cannot invalidate something that is totally wrong. It is absolutely wrong to collect money as a, pardon? You cannot validate something that is wrong. This is totally wrong. You cannot, and even if you could validate something like this, even if you could, you would rise up against taking people's money without due process, without having a law in place. So this act, something is awfully wrong. Something smells. And I do not blame the government, you know. I do not blame the government. I blame the people who give these things, because I don't expect our honored MPs who are not familiar with this legislation to know these things. Something should be certified to the minister and say whether it's in order to go to Parliament. This is not in order. I say no more on that score. I, sir, recognize that the hospital needs money. But is this the best way to get money for the hospital? I remember as a young man growing up, I heard our taxes were supposed to be for health, roads, education. Those were the main things. So we were already paying taxes in that regard. Now you're bringing a new tax. But we're already paying for them already. What do you mean you want more? So is this measure, when we pay this money into the, not the consolidated fund, into the National Insurance Fund, and then National Insurance Fund transfer, are we still going to be getting money from the consolidated fund to pay the hospital, or this is intended to finance the hospital, or this is just supplemental? I don't know, it's not been explained. But yes, I understand the hospital needs money, and it needs help, and it needs modernizing, it needs cleaning. You know, I travel with a can of Lysol in my cubby hole, and when I go to the hospital, I sit down in the seat and I spread the bottom of my shoes before I get in my car. Because I'm afraid this is dirty. So I don't have no problem with the hospital getting money to things. You know, I just want to make sure that the government do it correctly. You know? I tell people, when my friends go to the hospital, I tell them, look, I am so scared of coming up there that if you got a cell phone, I will call you. If you come out, I will visit you at home. If you die, I come to your phone, but I'm not coming up there. I am so afraid of going to this place. So I want the hospital to be sorted out, but I want you to do it properly. That's the problem I have, you know. I don't have a problem with a lot of things that the government is doing. I just have a problem with the way they're doing it. I know the intent is good, but you know they said the road to hell is paved with good intention. I know we need restructuring too, but how you are doing it is wrong. It's more painful than it has to be. That is what I'm concerned about. This measure, yes, the end result is desirable, but how you are doing it is illegal. I want to touch on one thing that has been bothering me for a lot of years. I'm going to two. The main thing is, Senator Walker said the hospital was opened in 1964, and care was free to citizens and residents of Barbados. If you were paying taxes in Barbados, a citizen or resident, you're supposed to be paying taxes. Care at the hospital was free. So people who come from overseas and they get residency in Barbados, they were entitled to free medical care because they too were working and paying into the consolidated fund, and for paying in the consolidated fund, they got free service at the hospital. Then in 1975, a new Immigration Act came into force, and it created a new category of legal resident in Barbados, immigrant. It created immigrant status. The only difference between an immigrant and a resident is that the minister responsible for immigration can revoke immigrant status. He cannot revoke residency. That's the only difference. And it was done in the 70s during the Black Power time when we had a lot of people punching the air and shouting, power, you know, remember, Mr. Speaker? And the then government was afraid of Stokely Carmichael and those people. So they rushed and put this measure in place, and if you misbehave yourself, the minister can put you out. So that was to take care of one problem, getting rid of people that the minister deemed undesirable. He cannot do it with immigrants, with residents. So, if you're a resident, the situation is that a resident and an immigrant, they all have the same, they do the same things. They pay the same national insurance, they work, they do everything. You live legally in Barbados. The difference now is at the hospital, people who are immigrants have to pay. Mind you, they're working in Barbados and they're paying taxes and they're going to be paying this national insurance levy too. But no, the hospital is saying, oh, the act says citizens and residents. and you don't have resident status, so you have to pay. That is wrong. So we have a lot of people in Barbados who pay taxes, who pay national insurance. Some of them pay more than the Barbadians because they're working for more, but they do not get the benefits of their taxes. Sir, that is wrong. It needs to be fixed. It is unfair. It is just, again, another part of the rush job when government's running to do things. You know, the problem was we want to get rid of people in Barbados fast. But in order to get rid of a resident from Barbados, you had to get a tribunal, 3 people, a judge, and 2 other people or something like this, to have an inquiry and determine if his residence had to be removed. The minister gets a recommendation from the Immigration Department, or you call the Immigration Department and tell you, give me a recommendation to remove him, and that person can go. But that person has been working in Barbados. He has been living in Barbados just like Barbadians, except he can't hold a passport. That's the only thing. He's doing everything else. And he has to pay at the hospital. I know of one instance where a young man has been working in Barbados. He's been working for years, and he was cutting down a tree, but you know, he cut the wrong side. He said he was standing on, and he had to get medical treatment at the hospital. He cannot afford it. He cannot afford it, so he had to find himself back in Guyana. And of course, now with the Barbadian dollars that he has, he could afford it in Guyana, because you know there's a Barbadian dollar, Guyanese dollar is about a cent Barbados or something like that. So he could afford it in Guyana, but he shouldn't have to do so. Having worked in Barbados and paying national insurance, now he's getting unemployment benefits because the employer say he left the country and they get medical treatment, and he didn't know he fired him. So, Mr. President, this needs to be fixed. It bothers me every time. I look at it, and every time people who non-nationals who come to me and they tell me about they have to pay, and sometimes they beg me for help, and I can't help everybody that comes. I do at times. They can't help all, but they shouldn't have to be begging. They should be entitled because they pay taxes like the ordinary Barbadian. The only thing is that the hospital now is reading the law so strictly, when they don't because every person who was a resident back in 1975, the only difference is that they didn't have a Barbados passport. The only difference now for immigrant status is that you don't have a Barbados passport either, you know. And then, of course, the minister can put you out, but they pay taxes. And that brings me to my last point, sir. Again, you know, national insurance is paid at a certain maximum. It used to be 4,360, but it went up recently. I don't know how much it is now. So if you are earning between $21 a month, no, it's $90 a month, or $21 a week, $90 a month, and that national insurance maximum, you pay the 10.1%, now 11.1% if this thing is passed. I mean, you're paying it already. You pay the 11.1%. So that means that the people at the bottom are paying a greater percentage of their salary than the people who are making $20,000 a month, because the 10% for them represents they're going to pay the same amount as the fellow who's making $4,000. So the burden is now also being put on the people at the bottom. And that's my concern, you know. When you put it in the national insurance, because national insurance cannot charge you any, there's no mechanism in place for national insurance to charge you on the total salary if your salary is more than the national insurance maximum, the 4,000, whatever it is. So you're now asking the poorest of the poor again to be taxed disproportionately to provide a service for everybody. That is why this measure should be a tax on income tax, where the people who pay more, because they're going to get the same treatment at the hospital. If I go to the hospital for treatment, I am penniless. I am going to get the same treatment as the fellow who got a lot of money. But the fellow at the bottom is paying more for it in terms of his contribution for the and that's why I find wrong with it. Mind you, as I said, I have no problem with the hospital getting the resources that it needs. It is just the way the government is doing it, I have a problem with. With those few words, Mr. President, I'm much obliged to you.
Mr. President, rise to speak hopefully briefly on this matter. Senator Walker has already pointed out some of the positives in this matter, and Senator Franklin has appealed on behalf of the disadvantaged, and I too wish to appeal on behalf of the disadvantaged. The category of person called an immigrant is treated at the hospital. In the case of emergency, they are never denied care. However, they have to pay. And it seems somewhat unreasonable that someone who works in the country, pays the taxes, and might even receive a pension from government will have to pay for services when they're ill simply because their status is immigrant status. And I have encountered persons who have been here for 40 years, who have grandchildren, who have had to pay, and it is wrong. It might be right in the eyes of the law, but it is morally wrong. The hospital has had years of underfunding and difficulties in servicing its debts. And the Minister of Finance, in the budget of June the 11th, did say that this measure will raise $45 million in the fiscal year. But she also said that it represents more than 25% of the budget of the hospital. She did not say it was additional funding. And I'm quoting from the budget. Whether that will change or not is left to be seen. Now, this 1.5%, Mr. President, that is paid by the employer, once again, adds to the pressures on the hospital. Because the hospital will have to pay, in an interesting way, into the NAS $1.3 million from its budget on behalf of its 2,000 plus workers. If this $45 million is not additional income, it means it's a net loss for the hospital. Because if it still gets its budget of $150 million, as did last year, it means it will get $150 million minus $1.3 million. So the measure will not give the hospital additional money. It will be a net loser for the hospital. So I hope that this is additional funding, Senator Walker. Now, interestingly, we have repealed successfully NSRL, and the hospital will save from that repeal $1.2 million. So there is some benefit from the NSRL repeal. The garbage and sewage tax, which is added to the water bill, adds an additional $800 payout from the hospital. So when we speak of this $45 million that will be raised in the fiscal year, we have to remember that it comes as guaranteed, hopefully guaranteed, income for the hospital. Rather than getting its money in drips and drabs, it will be given to the hospital as a steady stream, and it will help the hospital to function in a better way by being able to pay its bills. But as far as the budget states, it is not additional funding. Now, I wish to comment briefly on the matter of the Accident and Emergency Department. There's a proposal within the budget to spend $11 million on the expansion of the A&E and improving the services in the A&E. And the principal aim seems to be to reduce the waiting time. And I presume that waiting time that we're speaking of is between arrival and being triaged by seeing a doctor. I was told, because I didn't hear it directly, that there was an announcement yesterday made. They said that the proposed waiting time will now be less than half an hour. That would have to be one of the best standards in the world. In fact, if it were possible, it would kill private practice, because you'll be seeing faster in the QEH than you can be seeing in the private clinics. I will be glad if it happens, because I do work at the QEH. No. But the problems of the A&E cannot be solved by making the A&E bigger. The problems in the A&E are multifactorial. Now, there are problems with the quality of the waiting space in the A&E, the access to beds, the number of rooms available for emergencies and stat room. But the problems in the A&E and its overcrowding are directly related to the inability to decant patients from the A&E into the main hospital. So there are lots of internal problems of services that have to be solved. For example, you might have a patient in the A&E for 4 hours on a trolley waiting for lab results. The lab runs a large commercial operation. You cannot process one sample at a time. It has to run maybe 60, 50 samples on a big carousel, on a big commercial machine. So you might have to wait 3 hours to get a result. So unless you fix the problems on the inside, you will see a larger, crowded A&E. It'll be a nice place to wait. It will not improve the situation. Simply making it bigger will not help. There has to be a comprehensive review of what happens, how patients are admitted, how they're discharged, when they're discharged, and when they do leave to make beds available. Because I can tell you, Mr. President, that most days when there are no beds available, it is because there are none. And no matter how big you make the A&E, you will not solve that problem. So there have to be lots of work done on the internal efficiency of the hospital. The other matter, Mr. President, relates to staffing. There are serious problems with the numbers of nurses in the nursing pool. The nursing pool, I understand, is 80 to 100 nurses short. And of those, 32 are established posts that are vacant. But nurses in this country are professionals, and they have to also look for professional upliftment. And every year, nurses migrate, as they should be able to do, to seek greener pastures. So unless we can find a way of replacing with quality nurses those who leave, we will forever be in this problem. So we have to do things that make nursing more attractive locally and will allow nurses to stay. That's for the nursing hierarchy to decide. But there are lots of things that have been suggested, none have been taken on board. So we have to work on, first of all, providing the opportunities to employ the numbers of nurses that we need. So, for example, when people complain about waiting lists in the operating room, one of the principal reasons is that you don't have sometimes staff to run the operating rooms, nursing staff. So, if a patient comes in and occupies a bed and gets cancelled, or a patient with trauma is with a fracture is waiting for surgery, and it can't be done because, on a timely fashion, because on an elective list, there wasn't time because there wasn't nursing staff. Until that problem is fixed, that's going to be a recurrent problem. So the person who's waiting for the bed in A&E can't get a bed because it's occupied with somebody you can't discharge, who should have been operated on 3 days ago. So I would like to appeal to the authorities, Mr. President, to work and spend some time fixing the problems of flow within the hospital. And making the A&E bigger will not help patient care unless they're done together. Now, the matter of the polyclinics that Senator Walcott spoke of has worked to some extent, but we have to be careful that we don't convert the QEH to another polyclinic. The QEH is a tertiary care institution. It is not a polyclinic. If you decide to offer polyclinic services in the QEH, you will convert to such. If you have triaged the patient and there's a decision made that the care that patient requires is best administered elsewhere, then the patient should be sent elsewhere. But attempts to provide that treatment in the tertiary care institution will worsen the problems that we have rather than fix it. Mr. President, I'm obliged to you.
Good night, colleagues. I rise to lend my voice in support of these amendments. I would firstly like to commend both Senator Franklin and Senator Maynard for their contributions, particularly as it pertains to the treatment of tax-paying immigrants. As a former member of staff of the QEH, I have borne witness to it, and it is something that is heartbreaking and something that I believe that in our sitting during these next 5 years, we should look to rectify. So there's a saying that the health of a nation is the wealth of a nation. And it's something that we hear so often, it has almost become a bit of a cliche. But in our situation, the health of our nation is indeed the wealth of our nation. Our investments in healthcare are investments in our human capital. Investment in healthcare is an investment in the nation's development. The World Health Organization tells us that universal healthcare is or should be a fundamental human right. And this is something that Barbados has a proud legacy of providing. Senator Walcott alluded to the fact that since the establishment of the QEH in 1964, we've been able to provide access to health care not only to our citizens, but to permanent residents. As Senator Maynard alluded to, the QEH is a tertiary care facility, meaning that you could come and access any range of services, including cardiac surgery, kidney transplant surgery, 6 different specialties of ophthalmic surgery, microsurgery, and minimally invasive surgery in obstetrics and gynecology and general surgery. It's a teaching hospital, a hospital that myself and my colleagues here would have benefited from gaining access to education to, and nurses as well have been able to benefit in terms of honing their skills and their discipline in that facility. But the public healthcare system is much wider than the QEH. We have the provision of services to the elderly at the geriatric hospital and district hospitals. You have the Barbados Drug Service. You have the psychiatric hospital, access to laboratory and radiology services. So I think that our healthcare system is indeed one that we can be proud of even though we can all admit that we do not have a perfect system. As our nation's demographics have changed over time, we've seen our disease profile change from infectious disease to the rise of the so commonly talked about chronic non-communicable diseases. Right now, 1 in 4 Barbadians suffers from an NCD. 1 in 4 adult Barbadians suffers from a non-communicable disease. And it's expected that by the year 2030, 1 in 3 Barbadians will have an NCD. By the year 2030, it's anticipated that 86.3% of our population deaths will be related to the prevalence of a non-communicable disease. Right now, the QEH admits over 21,000 persons annually, and our outpatient clinics provide services to over 120,000 patients per year. I saw a really staggering figure in the Advisory Commission of Inquiry into the Queen Elizabeth Hospital report. It's a 1998 document, which is quite old. But even from that point, it reported that the bed occupancy rate for the QEH was 122%. So when Dr. Maynard spoke to the fact that the issue with waiting times in the hospital is largely linked to the fact that there are no beds sometimes on the wards, we can see that our resources are stretched beyond capacity. You could have the finest surgeons in the world, you can have the best trained nurses, and if the resources aren't there infrastructurally, if the resources aren't there in terms of consumables, if the resources aren't there in terms of equipment, in terms of financing, you're going to have some of the problems that we're seeing. So with this outpacing of patients, both inpatient and outpatient, access to the public healthcare system, we have seen a level of service delivery that is less than what we would desire. The Barbados Drug Service as well has been taking a hit because of escalating demands on their services and also the rising cost of pharmaceuticals on the international level. The last available Chief Medical Officer report reports that 13% of government expenditure goes towards healthcare, and $64 million goes towards treating patients with chronic non-communicable diseases. So there is a cost attached to the delivery of healthcare. We tend not to see it because obviously with our system, we don't pay at the point of delivery, but yes, indeed, there is a cost attached. The World Health Organization indicates that Barbados's healthcare spend per capita is $1,450 per person. This exceeds the per capita spend for all of our neighbors, excluding the Bahamas. I got a breakdown of expenditure for the hospital. So annually, they're budgeted about $145 million, although they need closer to $200 million to function. So typically there's been about a $45 million shortfall, and this revenue generating measure, as I understand, is intended to close that shortfall in what is laid in the estimates. So I got a breakdown of some of the costs. There's $93 million annually going towards the payment of salaries, $8.5 million going towards the payment of NIS, $2.5 million going towards the payment of pensions, and $2.5 million towards debt payments for the QEH alone. And those are payments occurring annually on a recurring basis. So we really need to rationalize healthcare financing in Barbados. I came across a document online published by the IMF. It's called Universal Healthcare 101, Lessons from the Eastern Caribbean and Beyond. And that document indicated a number of models for healthcare financing. One is the one that we have done in the past, where through general taxation, healthcare was funded. Another measure that they indicated could be done is the collection of Social Security contributions. And another one that was referenced was to that of user fees. I am aware that in the past, I can acknowledge that the previous administration was also looking at ways to have a sustainable financing model for the public healthcare system. Through one of the public accountability meetings that the QEH holds, that I would usually attend, I was made aware that they did investigate the possibility of implementing user fees. But that particular method was determined to be inequitable. $5 from my pocket is not $5 from some person who might not make the level of income that I make. So it was determined that perhaps the health service contribution or a national health insurance scheme perhaps would be a more equitable way of having taxes collected towards healthcare financing. And the document that I had referenced, the working paper, actually acknowledges that having these social security contributions or general taxation are favored ways of collecting over health service, over a direct payment at point of care, which will be a user fee. So one of the measures that we saw the previous administration implement with the intention of addressing the shortfall in funding for the hospital was the National Social Responsibility Levy. Excuse me.
I am leaving the chamber for 3 minutes. Thank you.
So the previous government would have been well aware of some of the issues that I have highlighted, and they would have made an attempt to look at a sustainable financing model for healthcare. What they had implemented was the National Social Responsibility Levy, and I quote, "The resources garnered would go directly towards financing of critical aspects of public health care, particularly but not limited to the provisioning of our general hospital." 10 months later, the NSRL was increased 400% to 10%, and within the first quarter of the levy being waged at that level, the first quarter, they raked in $50 million. And I challenge anyone sitting in here today to show me that they are aware that a penny of the revenue generated went to its intended benefactor. This Barbados Labour Party government, having repealed the NSRL, now seeks to introduce a health service contribution of 2.5%, which will be divided between the employer and the employee, 1.5% from the employer and 1% from the employee. And unlike the NSRL, we have it enshrined in the legislation that the funds directed must go towards the QEH. And I will direct you to page 4 of your bill, where section 20B2 says that contributions collected under this part shall be paid to the Queen Elizabeth Hospital. So my hope is that with the resources garnered, we can see a return to the high standard that we have been proud of in the past. I am personally proud of the Minister of Health's commitment to the fight against non-communicable diseases. Only this past weekend, we saw the launch of Barbados Moves, which is a part of a Caribbean-wide initiative to get people moving, get people physically active, getting people more aware of the impact of lifestyle on their health, with the aim of ultimately reducing non-communicable diseases. I am personally involved in an effort by the Healthy Caribbean Coalition to reduce the rates of childhood overweight and obesity. We're in the process of going into each school on weekdays, and the Minister of Health was also able to join us at our opening. The effort is aimed at increasing the children's awareness of what they're consuming in terms of their diet and getting them to also increase their physical exercise, with the hope ultimately of reversing the trends that we're seeing in our morbidity and mortality rates related to non-communicable diseases. I am also pleased that one of the first acts of this government was to commit to expanding the physical plant of the Accident and Emergency Department, which is what Dr. Maynard would have referenced. I do agree with him that the plan does need a more holistic approach. Expanding the physical plant is just one part of it, but we also need to look at the capacity of the laboratory, we need to look at the human resources, we need to look at the management structures and systems that would improve overall efficiency. I was also, in my research, I came across the fact that there was a plan by the previous government to look at possibly having a new hospital built. I saw in a newspaper article in The Nation, December 31st, 2013, that they were going to spend about $15 million conducting a feasibility study on having a new hospital built. We haven't heard anything else about that. Perhaps there was an implementation deficit. I'm also proud that one of the first steps that our government also had taken was to have the streets on the South Coast cleaned up. The reality is that it was more than an eyesore. It was actually a public health issue. We heard of the cases of gastroenteritis. So I was also proud of the administration for taking action and making that a mission critical priority. One of the government's other priorities is having what we call health is wellness grants, where we're trying to encourage people to avoid developing non-communicable diseases, or if they have established non-communicable diseases, to keep them managed to the point that they don't develop the complications related to their disease conditions. One of the final things that I want to address is the plan of the government to seek to digitize across the entire public sector and also to digitize healthcare. I think that is a priority, as it should be. And one of the things that I hope to see is the data that we can access once everything is available electronically, that we can really exploit that information in terms of policy planning, in terms of allocating resources, and in terms of planning for the future, so that we truly have a healthcare system that is fit for purpose, which has been a common phrase that we've been hearing. But healthcare extends beyond the Ministry of Health. I also was pleased to see that there are a number of plans that will be coming on stream in the next few years, including a proposed Clean Air Act. We need to look at issues surrounding air quality and emissions as far as it pertains to not just respiratory health, but the World Health Organization recognizes vehicular emissions as a source, as a possible carcinogen, which basically means that they could increase your risk of developing cancer in time. So taking actions on these would actually save the country in the long term in terms of the wellness of our citizens. There are plans to develop more public recreational facilities. We see how having the Richard Haynes Boardwalk, which was built under the last term, how that has actually gotten people out of their homes. You see even young moms pushing their strollers and getting going. So having the public spaces for people to be active, they matter, and I'm glad to see those plans on stream as well. So I see this measure as the beginning of a strengthening, a reinvigoration, and a transformation of our healthcare system into one that is fit for purpose, and by extension, a measure that will ensure that our people are also fit for purpose. I thank you for obliging me.
Thank you, Mr. President. Mr. President, as we debate this National Insurance Amendment Bill, I just have one question to the government of Barbados, and that is, what is its aversion to allowing senators who have to deliberate on these pieces of legislation ample time to do so, and the provision of the information in a manner that would allow them to make substantive and plausible and feasible contributions to the debate. You will notice that apart from Senator Maynard, who has specialist knowledge on the particular topic, that is to say, the hospital, no other person on the independent side has spoken this evening, and that is because who didn't get this information last night got it this morning, or got it this afternoon or this morning when they came in to the Senate. Senator Haynes was able to use the words like research, but she also used a beautiful phrase, information deficit. That was beautiful, Senator Haynes. Information deficit. That is the malady of the persons on this side. So my issue is, but I happen to know as an attorney that when you are reviewing legislation, it's not just looking at the words. There are references to all of this legislation today. We're now doing let me get it right, because there's so many of them that came at us, and it coming today to you all may not be a big thing, but coming to us today is a big thing because we want to be able to make sure, for example, we have the one that is today, and if it wasn't for Senator Franklin and Senator Drakes, we would be passing a piece of legislation today, the National Insurance and Social Security Act Amendment, don't cite it wrong, the National Insurance and Social Security Amendment and Validation Act 2018. And it is the opposition again that highlight a fundamental error in the schedule, that the wrong percentages were recorded or drafted. That same thing happened, Mr. President, when we were discussing the 5% increase. So if it wasn't for the diligence of the opposition, this would be the second set of legislation that would have passed without amendments. Senator Walker conceded and accepted and admitted and declared that it was Senator Franklin who was able to bring it to his attention. My issue is these things will happen if we do not have time to look at it. And my concern is because of the quality and standard of the bills that are coming to this House, it is not just the content we are looking at anymore. We are now required to look at the format. Because I certainly, as an attorney of a number of years, I do not want to be associated with bad law, incorrect law that has to be amended because we are not looking at it, we're not getting opportunity to look at it. What is the problem? What is the aversion to giving us time to at least look at it and make sure that we agree with it? We all know that we're getting bad drafting up here. It is not a secret. We are not getting time, and we're not, don't get me wrong, it is not our function to fix bad law, bad drafting. But because we are serious about what we're doing collectively, we are all looking at it, some more than others because of their skill, and highlighting the deficiencies. We cannot do it if we're getting it today for today. And the problem I have with this set for today, and I quote, I can't even listen. This is the first one that somebody had to help me with the pronunciation of dematerialization. What is it, Mr. President? We had the first reading of the Dematerialization of Government Securities Bill. Then we had the first reading of the Local Loans Amendment Bill. Then we had the first reading of the Saving Bonds Amendment Bill. Then we had the reading of the Treasury Bills and Tax Certificates Amendment Bill. Then we had the Local Loans Amendment Bill. You know the problem I have with all these? I know nothing about this type of area. I know nothing about this. I know nothing about any of this, but I can look briefly en passant, because that's all I had a chance to do, and see errors in this drafting. And it's not my function to fix it, but I should have had an opportunity to say to the House, this here don't make sense. Just as how I highlighted when we did the road traffic bill, I had and in section 16 and or in section 15. This is unacceptable. We should have an opportunity to confer with persons who can tell me the pronunciation, what it means, what to do, what to say, what to ask. Yeah, but I ain't feeling my back right now, Senator Walker. And you can't distract me like, oh, you distract Senator Franklin. I good. This is what I do. We're not getting a chance to confer with anyone. And you know what also blows my mind, Mr. President? When not a government senator don't say anything either. Because they don't have anything to say either. Because they don't know either. Let me tell you who can talk. Senator Grant can talk. But he's a veteran. Senator Hayes spoke by the hospital. And she talked about, she had the luxury of talking about research. Nobody can research anything. Maybe getting it today for today. And these are critical bills. If we are saying that they're all tied up with the debt restructuring program of BERT, I ain't helping you with that, Mr. Franklin. We should be looking at this thing seriously and holistically. We can't do it. Listen, we don't know what y'all have. Notice I was outside. I refuse to be a part of the committee part of this. For anybody to see that I was sitting down here because I could not contribute to anything that needed to be amended. We have, listen, this is such lazy drafting going on here. Oh, merciful Father, Son, thy blessing upon us gathered here. We have the Dematerialization of Government Securities Act. Just now. And it defines dematerialized in, Mr. President, the bill that speaks to Dematerialization of Government Securities Act, Mr. President. That is here. The word dematerialization and dematerialized is defined in that legislation. You're listening to me, Mr. President, because you're going to understand me. You're going to understand me. Then all these other interrelated bills, hear what they have done, Mr. President. In the proposed bill for the Treasury Bills and Tax Certificates Amendment Act, Mr. President, here it is. In this act, the Treasury Act, dematerialized has the same meaning assigned to it in Section 2 of the Dematerialization of Government Securities Act. So if you have, this cannot be a standalone. You have to get the other one to understand what this means. That's lazy drafting, Mr. President. The amount of time it took to type that, you could have defined it pursuant to what it is in the Dematerialization Act. And it goes again. We do it again in the Local Loans Act. Again, the Local Loans Amendment Act. Dematerialized has the meaning assigned to it in Section 2 of the Dematerialization of Government Securities Act. Register means the register of the dematerialized securities kept in accordance with Section 5 of the Dematerialization of Government Securities Act. So all of these, the lazy drafting, I am not going to be able to comment on this because I have not had an opportunity to say anything. I haven't had the opportunity to read it. To be able to say, Senator Walker, this could be better. Senator Walker, look what happening here. So in order to be able to look at one piece of legislation, you got to have the dematerialization one. You got to bring in another one to understand this thing that is all connected to debt restructuring. It's not supposed to be so complicated. And when you keep doing this kind of legislation that is convoluted, complicated, confused, and enough amendments, it makes the process of the practice of law and the understanding and interpretation of the law and the legislation confused. It affects interpretation. All this could be affected in a positive way. Stop. Take a minute. Let's look at it. Let's discuss it. Let's come up with the best plan possible. Mr. President, why do I have to have the Dematerialization Act to look at the Treasury Act or the Savings Bond Act or the Local Loans Act, Mr. President? Why?
I have given you, Senator, great latitude, but the truth is that
I know, they happened already.
That you are raising,
yes, Mr. President, I'm guided.
In a sense, addressed this morning and we decided that notwithstanding the late notice that was given in relation to 3 or 4 matters coming before us today, some people said they first saw it at 3 a.m. this morning, some said they saw it when they got to work at past 8, 9 o'clock. We decided that we would still proceed because they are all related to the debt restructuring, and there's a narrow time frame within which we have to get it done. So that I've given you great latitude, but I'm afraid that I cannot give you any more.
Thank you, Mr. President.
Yes.
Thank you, Mr. President. I just have one last
Not
question.
to say, however, that you have not made valid points.
I have not made valid points.
That's not to say that.
I was about to say, let me sit
I'm
down.
saying that is not to say you have not made. But we had, notwithstanding that, we decided this morning.
Thank you, Mr. President.
that
I just felt the need to make that reference because I think what made it rise up in me is when I saw once again in the national insurance legislation, there was a fundamental error. And it just riled me back up, Mr. President. It seems as if I say this every time we have something serious to do in here. And I wanted to go on record as registering my concern. Mr. Walcott is not a lawyer. He should not have to come in here and be doing what he has to do almost every time we're in here, because he then has to be guided or he has to take instruction. He doesn't know if he's being directed properly or not. But this is the second time that we've had that.
The drafting department will hear you.
I'm sure they will, but that does not take away from the fact that at the end of the day, these things will happen when you get things today for today, and it is not reasonable for the senators to be associated with this kind of thing, because then I get that things are in a hurry. I'm not in a hurry to be in a hurry because it's urgent, but being in a hurry does not mean that we are supposed to be reckless or negligent or careless. So whoever is responsible for this draft needs to get on we are in a hurry. I think Senator Grant, I could be wrong, but I just like to call his name. But I think it's Senator Grant who talked about we have to do it urgent. Urgent doesn't mean slack. Urgent doesn't mean careless. Urgent doesn't mean exposing. Senator Franklin is always covering and saying it's not the Prime Minister's fault. It should not be that the houses have this to deal with. This is unacceptable. Substandard nonsense going on with this drafting. How can it be that if he wasn't still a member, y'all would be passing bad law? That's not right. But you tell me. We can't be doing this, and we just going because we need to pass it in a hurry, because we need to get Burke up and running, and the IMF says we have to do things. I understand. But when we do it wrong, it only takes one person to say, this may have been your intention, but the law actually says this, you have a problem. Then we got to come back and fix it. And litigation and costs. People only waiting for the loopholes. I don't want to be associated with loopholes. But if it's coming this quickly, we don't have time to check.
Senator, you've made your
Thank
point.
you,
You've
Mr.
made it
President.
vigorously and eloquently well.
I'm obliged to you.
I have no doubt that Senator Walcott would indicate to the Attorney General the observations and comments made with respect to the drafting, and I earnestly hope that we can look forward to an improvement in that regard. So thank you. Senator Grant.
Thank you, Mr. President. On this occasion, I'm going to be very brief in relation to Mr. President. I really don't understand. I intend, sir, on this occasion, to be very brief in my comments as it relates to debating the bill before us. Sir, you know, I think that we have to, again, look at this amendment from a more comprehensive perspective. I'm told that the QEH is referred to as it's a a primary care institution. That's a tertiary care institution. It's also a teaching hospital. And the health care being provided is not only for locals, but locals and visitors alike. And I think, sir, that it's important that we start to contemplate, and I know that some discussion has been been engaged in with respect to this, but having a 24-hour fully operational hospital and a fully operational healthcare system. Sir, in many areas, and in particular in the area that I function, tourism, we are competing with the rest of the world. And you know, sir, when I travel and I make presentations in relation to Barbados, and I speak about Barbados as a tourism destination, I don't only reflect on the hardcore tourism aspects. I don't only reflect, sir, on the different type of hotels that we have, the restaurants, the attractions, not just those things. I also reflect generally on the other things that Barbados has to offer. I speak, sir, about the information communication technology. I speak, sir, about the health services. The truth is that a visitor coming to Barbados wants to know that the services available at our hospital and available at our polyclinics are of a standard and of a level, sir, that is globally acceptable. And I have, sir, at the very beginning to acknowledge the significant contribution of the staff at the Queen Elizabeth Hospital. Of course, it has been very challenging. You know, sir, under the last administration, the estimates of revenue and expenditure, which reflected monies for the Queen Elizabeth Hospital, have always been understated. And you know, there was always the clear understanding by those administering the affairs at the Ministry of Health and those involved with the Queen Elizabeth Hospital that the monies allocated within the budget and within the estimates for the QEH was simply not enough. But yet we went through that exercise, which was in some regards meaningless, because it makes absolutely no sense reflecting estimate figures that you know are not real figures. And one of the things that we are seeking to do, sir, is to have a comprehensive restructure. We certainly, even in the area of our healthcare services, cannot continue to administer things in the way that we have been. What this amendment does, Mr. President, is to facilitate the monies going directly from the NIS to the Queen Elizabeth Hospital. We have heard from the leader of government business in relation to challenges that would have existed before in terms of the NSRL and the availability of the monies not going directly to the QEH. And while I hear some of the concerns that have been raised in relation to the manner in which this is being done, I want us, Mr. President, not to lose sight of the fundamental objective which we have in facilitating the funding at the QEH and providing directly those funds that come with respect to this amendment being done. So, sir, I think it is important for us to recognize that we do have to look at new methodologies with respect to the funding of our health care. And you know, sometimes when I hear these debates, I wonder, if I could go back in time. Because this, sir, is a fundamentally different environment to 20, 30 years ago. And this is a lot more fast-paced. I take the comments made with respect to the need to make sure that we do things as best as we can and as properly as we can. But I've made the point in this chamber before. We do not have the luxury of time. We do not have it. And sir, Mr. President, I intend, and this may sound a little bit ridiculous, but I intend, sir, to go next week, and I can buy a donkey, and I can buy a donkey cart, and I can go on the highway, and I can use it as my mode of transportation. Sir, it will not only affect my ability to get from one meeting to another, but you know what? It is going to impact on the other users of the road. Again, sir, the point is that we have to become relevant to the times. And we have to transform the manner in which the funding of our healthcare system is being undertaken. That is the reality. And we have to do it with some measure of urgency. Mr. President, sir, will we always get it right? No, sir. Will we get it right most of the time? Yes, sir. Are we, sir, going in the right direction, sir? Yes, sir. Are we pursuing the correct objectives? Yes, sir. And we have to move swiftly because time is not on our side. And the transformation of our society cannot be done in a piecemeal manner. And sir, I have been around politics for a little while. In fact, sir, there is a senator in this chamber that her father helped to coach me and helped me along politically, even when I left the party that he was with. But I've been around politics for a little while, and from recollection, it is not unusual when government has an agenda, and not just here, not just here in Barbados. It is not unusual for legislation to be dealt with in another place, and then for that legislation to come to the next chamber the next day. I believe, sir, I normally see emails coming from Parliament which relate to legislation that is going to the other place. And I believe, sir, that the reason why that is done is to try to give us some early notice. But you know what, sir? Sometimes we will be required to burn the midnight oil in order to get the people's business done. Sometimes, sir, it means that we might not be able to sleep, but we have to get the people's business done. Well, we have to get, sir, the people's business done, and we have, sir, to be able, in very short order, to transform how we are doing things. I think, as well, there's been some reference to ICT upgrade. Of course, we have to make sure that we come into the modern world realities and that we do not compromise the healthcare and the public health services that we provide. So, Mr. President, I want, with those few words, just a few words, to encourage honorable senators to support this bill with the clear recognition that while we talk about this bill, there's really a much larger objective which the government of Barbados is pursuing in seeking to ensure that we are able to deal with the challenges that exist to ensure that we do not compromise the health services that we provide, to ensure that we provide the appropriate funding that is required, and to ensure that we are able to take care of the health of Barbadians. You know, sir, I believe that there are two areas that we must always ensure we find the necessary resources for: education and health care. Sir, those are critical for the functioning of Barbadians and critical for the development of Barbados as a nation. And therefore, sir, I want to encourage all honourable senators to support this bill and to let us, as a Senate, seek to take Barbados forward and onward. I thank you, sir.
So I just want to, I just want to make a 2-minute speech, honestly, a 2-minute speech. And merely to comment on what two of the senators have said, and in fact to agree with them as to what they said during their presentations. This has to do with a special account, the NIS, which is to benefit the Queen Elizabeth Hospital. And Senator Franklin was making the point that it was unconstitutional because you didn't have the law in place before you started. You started off on the wrong foot and so on. And the point I wanted to make on that submission by Senator Franklin is that in a lot of the statutes that we have on our statute books, that there is provision for something called a validation to be done. And simply put, what that is that it is a procedure which we use. It affords us the opportunity to validate a provision without having to make the statute or the document null and void. So you just go back and you do the validation. For instance, if you were doing a conveyance and the person who's living overseas did not obtain the exchange control permission, when you come later on to look at that document, you can do a document called a validation, which breathes new life into it. You don't destroy the document and say that it's no use anymore. So this is one of the instances where we can use the validation, and we can have, it doesn't mean that there's no law. It doesn't mean that it is unconstitutional. We can keep moving. That's one of the points. I also want to agree with Senator Franklin. And
Mr. President, point of order. Even though he's going to agree with me, he might not want to after I finish, but this...
What are you on, sir?
Point of order. He's misleading us. This act provides that if the money is not, if the tax is not, if the legislation is not passed within 4 months, you're supposed to pay it back. You're supposed to give back people the money. This is what it says. You have no lawful authority to take that money within that 4 month and outside that 4 month period. You're supposed to pay it back. You can't validate a wrong. It was unconstitutional to take their people's money without due process of law. There was no law in place. The law gives you 4 months, and you were outside of the law. Validating it, you are now actually passing laws in retrospect, and that is wrong.
Senator, you are involved in repetition. You said that in the course of your presentation.
Yes, but it was misleading us. I had to.
Please continue.
No, I ain't gonna put a lash in it. Yeah, I was saying that I agreed with Senator Franklin on the point of the immigration point. No, I agree with him. I agree with Senator Maynard. Senator Maynard made the same point. And Senator Haynes made the same point. which is that there are some of our neighbors, they come here, they live, especially people from Guyana, St. Vincent, and so on. And, for instance, they get into some accidents here on our roads, and they're very, very badly injured. And I have clients, about 4 of them, who fall into that category. And they go to the Queen Elizabeth Hospital with broken legs and broken hands and all types of injury. And they have to pay for the treatment. And what sometimes riles me is the fact that they get some threatening letters from the hospital after they had not paid for 6 months or so. And then when you see the long list and the amount of money that they are in debt to the hospital, you said, wow, I didn't realize it was this amount. Some is $13,000, $14,000. But they're detailed. Every visit and so on, you have detailed. And the threats that if they do not pay by a certain time, that the treatment would cease. And they don't have the money. Sometimes you have to write and tell them, well, when these clients get their compensation, I will ensure that the first thing happens is that the QAH will be paid. And you have to write those letters so as to satisfy them. But as has been said, these are people here who work, who pay taxes, and so on. And so please do not think that this is something that's happening since, you know. No, it didn't happen since the 24th of May. 1975. But it is something which we all of us in here, I'm sure we are very, very concerned about. And I do believe that, as Senator Maynard hinted, that, you know, they take a Hippocratic oath. And I believe they have a duty when someone turns up at the hospital, whether you are an immigrant, a resident, or whoever, that they have a duty to look after that person. But it may happen at the beginning, but when the person keeps going and going and going, then that is another story. In terms of another point which was made by Senator Maynard, and it has to do with the migration of nurses, and I add, and doctors. And the migration of nurses is something that worries me. And it worries me because we have trained these nurses. And sometimes we give them extremely good training, and then they leave and they go elsewhere, and that elsewhere gets the benefit of all the money, all the training we've put into those nurses. And it is a real brain drain. It's a brain drain too on the doctors. There's so many, the doctors who, they're in service, sometimes they can't even find somewhere to do it, I should say. At the hospital, they're crowded, this place is crowded. They have to leave and go to, I know about 3 of them who are in Tobago. Then they wanted to do in service, they couldn't find anywhere to do in service. And it is something which I'm sure it would worry all of us, and we really and truly have to look at that. That too is a brain drain, that our doctors have to go elsewhere to find work. The last point that I wanted to comment on was the point made by Senator Tate. And I agree with Senator Tate that, you know, the whole question of the things coming to the... I think that draftsmen, when we are doing certain bits of legislation, should be here on the spot. I feel that the draftsmen from the AG's chambers should be here on the spot, whether we are here or in the other place. And I think that that is one of the things that we have to try to make some noise and say, when we know that we are going to be doing the legislation, let the draftsman, the person who did the drafting, or at least someone from the office, let that person or those persons be here in the chamber with us. I'm obliged to you, sir.
Thank you, Mr. President. As I rise to wrap up debate on this bill, I want to thank the honourable members who have spoken, share some of their concerns. In terms of the draftsmen, I believe we've had them present from time to time. Certainly in June, or I think it was in August, there was one here during one of the debates we did, but as you said, that perhaps it would be something, it would be good if someone could be present from the SG's office, certainly in the lower house and here when we're discussing matters like this.
Standard in the 70s.
I take Senator Tate's concerns, and I have my own concerns too. I believe all of us on this side received the bills at the same time in the early hours of this morning. But I am going to commend you all for enduring it and participating, even by abstaining, but at least you made your voice heard and you made some suggestions, and I commend you for that in the circumstances. Mr. President, I'm not going to delay the business of this Honourable Chamber too long on this matter. I think it's fairly straightforward. I want to thank honourable members that during the course of the debate, they kept strictly to the QEH, and they did go into the forays of the NIS and the effects on the NIS in terms of the restructuring. Again, I commend you for that, keeping us on track, all of us on both sides of this chamber. In terms of the matter raised by Senator Franklin, the constitutional expert resident, in the Barbados Constitution, Chapter 9, Finance, Clause 107. In terms of your arguments about the consolidated fund, I take them, I heard them, I agree with them to some extent. But it states that 107, there shall be in and for Barbados a consolidated fund, to which, subject to the provisions of any law for the time being in force in Barbados, shall be credited all revenues of Barbados, subject to the provisions of any law for the time being in force in Barbados. I believe that is what we are discussing at this point in time, a law. And with those few words,
a point of clarification, Mr. President. This act says, for the purposes of this act, no other. So this act must be followed. And it says, unless you are paying it into the consolidated fund, you can't do it under this. That's what it's saying.
Please take your seat. There is no point of order on the
I know I said, I was clarification. He's misquoting me, you know. Is it for the purposes of this act, no other?
Standing orders don't admit of points of clarification, except with the permission of the chair. You do not have it.
Okay. I'll be getting tired.
Mr. President, with those few words, I beg to move that this bill be now read a second time.
Well, it has been moved that the bill under consideration, namely the amendment to the National Insurance and Social Security Act, be now read a second time. All honourable members in favour, please say aye. Aye. Those against, please say no.
No.
I think the ayes have it.
Mr. President, I beg to move that Your Honour do not leave the chair and the Senate resolve itself into committee for further consideration of this bill.
It's been moved that I do not leave the chair, that the Senate resolve itself into the committee for the further hearing of this matter. All members in favour, please say aye. 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 I think the ayes have it.
The Senate is now in committee.
Clause 1.
Mr. Chairman, I beg to move that Clause 1 stand part.
The question is that Clause 1 stand part. Honourable Senators in favour, please say aye. Aye. Those against, please say no. Methinks the ayes have it.
Clause 2.
Mr. Chairman, I beg to move that Clause 2 stand part.
The question is that Clause 2 stand part. Honourable Senators in favour, please say aye. Aye. Those against, please say no. Methinks the ayes have it.
Clause 3.
Mr. Chair, I beg to move that Clause 3 stand part.
The question is that Clause 3 stand part. Honourable Senators in favour, please say aye. Aye. Those against, please say no. Methinks the ayes have it.
Clause 4.
Mr. Chair, I beg to move that Clause 4 stand part.
The question is that Clause 4 stand part. Honourable Senators in favour, please say aye. Aye. Those against, please say no. Methinks the ayes have it.
Clause 5.
Chair, I beg to move that clause 5 stand part.
The question is that clause 5 stand part. Honourable senators in favour, please say aye. Those against, please say no. Methinks the ayes have it.
Clause 6.
Chair, I beg to move that clause 6 stand part.
The question is that clause 6 stand part. Honourable senators in favour, please say aye. Those against, please say no. Methinks the ayes have it.
Schedule.
Mr. Chair, I beg to move that the schedule as amended earlier be the schedule to... Okay. It should be instead of 15.5, it should be 16.1, and instead of 16.5, it should be 17.1. Okay, in the first schedule, delete the words 15.50. I'm saying that it should be 16.10, and where it says substitute the word 16.50, it should be 17.10. So I'm asking that the schedule be the schedule to the schedule as amended be the schedule to the bill.
The question is that the schedule as amended be the schedule to the bill. Honourable senators in favour, please say aye. Aye. Those against, please say no. Methinks the ayes have it.
Mr. Chair, I beg to move that you do not report to His Honour the President the passing of one bill in committee.
The question is that I do now report to His Honour the President the passing of one bill in committee. All those honourable senators in favour, please say aye. Aye. Those against, please say no. Methinks the ayes have it.
Speaking of road traffic. Oh, yes.
The chairman has reported to me the passage of the bill under consideration in committee with amendments.
Mr. President, I beg to move that this bill be now read a third time.
It has been moved that the bill under consideration be now read a third time. All honourable members in favour, please say aye. Aye. Those in favour, please say no. I think the ayes have it.
Mr. President, I beg to move that this bill do now pass and be cited as the National Insurance and Social Security Amendment and Validation Act 2018.
We move that the bill be now read. The bill do now pass and be so cited. All honourable members in favour, please say aye. Those against, please say no. I think the ayes have it.
Order number 1, sir. In the name of the Honourable Leader of the Senate, to resume the debate on the second reading of the Road Traffic Amendment Bill 2018.
Doing it now, sir. We're doing it. We're doing it. Thank you, Mr. President.
You think I live here? You think I live here?
Mr. President, I rise to wrap up the debate on this matter. I believe it was most honourable members have spoken, have expressed their concerns, and in wrapping up, I will endeavour to address some of the concerns. I've had discussions with the relevant agencies. I believe there were some concerns expressed in the bill on page 6 under the 2 related to the definitions of commercial and private vehicles. I've had discussions with the Office of the CPC, and they have the directions from the ministry, and in their opinion, there was no need to change these definitions. They said it is not normally the position of the ministry, or indeed anyone, to ask persons in the professions, lawyers, doctors, etc., if they're not going to use their vehicles for commercial purposes. They thought the idea was ludicrous, and that you would be put in a category of commercial if you're going to see a client or indeed a patient. And their advice was to leave the definitions as they are. On B, it says deleting the words 11 to 24 in the definition of a minibus and substituting the words 21 to 57. We recognize that this is an error, and it was agreed that it should be amended to be saying not 21 to 57, but 11 to 57, 11 passengers to 57 passengers. Issues were raised in terms of under clause 18, the registration identifier, about a registration card or registration sticker and card. The advice was to leave this because the intention is to have stickers. They are not yet here. But in terms of the queries, if you were stopped and that you could be summarily convicted or fined, they addressed that. They said it had been addressed, in fact, in the bill. And at page 27, 38, in terms of the commencement. And they said that the amendments directed to be made to the Principal Act by Section 16A, speaking to the view being found without the sticker. And Part 2 of the second schedule shall come into operation on a date to be fixed by proclamation. So in other words, when this bill is passed and is proclaimed, it will be proclaimed, my understanding, and that section will be excluded for the time being to be included at a later date. That was the instructions or directions of the CPC's office. Mr. President, I don't believe there's anything else to say about this at this point in time, and I beg to move that this bill be now read a second time.
Question is that the Road Traffic Amendment Act 2018, that bill be now read a second time. All honourable members in favour, please say aye. Those against, please say no. I think the ayes have it.
Mr. President, I beg to move that Your Honor do not leave the chair and the Senate resolve itself into committee for further consideration of this bill.
Motion is that I do now leave the chair and the Senate resolve itself into committee for the further consideration of this measure. All honourable members in favour, please say aye. Aye. I think the ayes have it.
This House is now, this Senate is now in committee.
Clauses 1 to 5.
Mr. Chairman, I beg to move that clauses 1 to 5 stand part.
The question is that clauses 1 to 5 stand part. Honourable senators in favour, please say aye.
Mr. President, if I understand it, clauses 1 to 5 include the amendment that was just made by Senator Walcott. So it would need to be as amended, and I still maintain that the private motor vehicle definition as it stands here will what's the word? Conflict with our private motor vehicle insurance policy. Private motor vehicle means a motor vehicle that is used exclusively for private purposes and not used for hire, reward, or in a business enterprise. This is madness if we are going to pass it as is. But in relation to the change that you made earlier at subsection 2B, subsection clause 2B, it would need to be as amended.
Mr. Chairman, I beg to move that clauses 1 to 4 to 5 as amended stand part.
The question is that clauses 1 to 5 as amended stand part.
Mr. Deputy President, may I suggest again that we are bold enough to remove the words "or in a business enterprise" in relation to a private motor vehicle, sir?
Chairman, that matter was raised also, and again the advice was to, in terms of the definition, was to leave it as it is. so I can only be guided by CPC's office. I beg to move that such clauses 1 to 5 as amended stand part.
The question is that clause 1 to 5 as amended stand part. Honourable senators in favour, please say aye. Those against, please say no.
No.
Methinks the ayes have it.
Clauses 6 to 10.
The question, yeah, go on.
Mr. Chairman, I beg to move that clauses 6 to 10 stand part.
The question is that clauses 6 to 10 stand part.
Mr. Chairman, we just passed clauses 1 to 5
As amended.
as amended. Then they included a new 5, capital A. It is not 5A, 5, thing. So you have to think. No, this is 5A. Who's going here? Okay. Okay.
The question is that clause 6 to 10 stand part. Honourable senators in favour, please say aye. Aye. Those against, please say no. Methinks the ayes have it.
Clauses 11 to 15.
Mr. Chairman, I beg to move that clauses 11 to 15 stand part.
The question is that clauses 11 to 15 stand part. Honourable senators in favour, please say aye. Aye. Those against, please say no. Methinks the ayes have it.
Clauses 16 to 20.
Mr. Chairman, I beg to move that clauses 16 to 20 stand part.
The question is that clauses 16 to 20 stand part. Honourable senators in favour, please say aye. Aye. Those against, please say no.
Excuse me, Deputy President. In clause 16, I believe it was Senator Drakes that highlighted that there were some typos in clause 19, subsection 4, as well as clause 20, subsection 4. They had of instead of or.
Subsection 4, you said? 3, 4. 17.
Not of, it has to go or to both. Your or. Same thing with 416.
1940.
416.
It's 1940. So 94 and which one?
If I can assist again, it would be clause.
You mean in clause 20, 24.
Sorry?
20.
I'm saying, okay, 24 and 19.4.
24.
19.
Clause 19, subsection 4, and clause
19.4.
24, yes. Mr. Deputy President, if I could just ask for Senator Walker to repeat again the explanation for the 15, 16 clauses, where between the sticker, where in 15, clause 15, it talks about and clause 16, it talks about or. Your explanation from your people.
Which sections these are again?
It's put in on 38. Mr. Chairman, I said that they don't have the stickers as yet. This is a matter to do with BRA and the Ministry of Public Works, and that they said that it was covered in terms of persons being stopped and not having both. That commencement under section 38, clause 38, they had put in to be made in terms of the Principal Act, that section 16A, part 2, shall come into operation on a date to be fixed by proclamation. So the intention is, if it is when the bill is passed or agreed to today, that section does not come into force, obviously, until later on, when they have the stickers and all of that. So for the time being, nobody will be affected. Mr. Chairman, I beg to move that clauses 16 as amended stand par.
16 to 20.
16 to 20 as amended stand
Mr. Chairman, that doesn't make sense because you're going to pass it. What will happen now, when your coming time for it to be... I've seen 38. When it's time now to be incorporated into the law, you got to come and amend it before you put it into the law. Fix it now, so you don't have to come back. And
you still have to come back when the stickers come.
I know, but what I'm saying to you is, fix. It's a waste of time.
Mr. Chairman, I'm sure you would also know, I'm being informed that there's something called an Evidence Act that was passed here a couple of years ago, and it spoke about video recording, etc. And it was inapplicable until the police acquired the equipment. It wasn't proclaimed. So this is not something new. This is something that happens from time to time. I beg, Mr. Chairman, I beg to move that clauses 16 to 20 as amended stand par.
Question is that clauses 16 to 20 as amended stand part. Honourable senators in favour, please say aye. Aye. Those against, please say no. Methinks the ayes have it.
Clauses 21 to 25.
Chairman, I beg to move that clauses 21 to 25 stand part.
The question is that clauses 21 to 25 stand part. Honourable senators in favour, please say aye. Aye. Those against, please say no. Methinks the ayes have it.
Clauses 26 to 30.
Mr. Chairman, I beg to move that clauses 26 to 30 stand part.
The question is that clauses 26 to 30 stand part. Honourable senators in favour, please say aye. Aye. Those against, please say no. Methinks the ayes have it.
Clauses 31 to 35.
Mr. Chairman, I beg to move that clauses 31 to 35 stand part.
The question is that clauses 31 to 35 stand part. Honourable senators in favour, please say aye. Aye. Those against, please say no. Methinks the ayes have it.
Clauses 36 to 38.
Chairman, I beg to move that clauses 36 to 38 stand part.
The question is that clauses 36 to 38 stand part. Honourable senators in favour, please say aye. Aye. Those against, please say no. Methinks the ayes have it.
First schedule.
Chairman, I beg to move that the first schedule be the schedule to the bill.
The question is that the first schedule be the schedule to the bill. Honourable senators in favour, please say aye. Aye. Those against, please say no. Methinks the ayes have it.
Second schedule.
Chairman, I beg to move that the second schedule be the schedule to the bill.
The question is that the second schedule be the second schedule to the bill. Honourable senators in favour, please say aye. Aye. Those against, please say no. Methinks the ayes have it.
Mr. Chairman, I beg to move that you do not report to His Honour the President the passing of one bill in committee.
The question is that I do now report to His Honour the President the passing of one bill in committee. Honourable senators in favour, please say aye. Aye. Those against, please say no. Methinks the ayes have it.
The chairman has reported to me the passage of the bill under consideration in committee with amendments.
Mr. President, I beg to move that this bill be now read a third time.
It has been moved that this bill under consideration be now read a third time. All honourable members in favour, please say aye. Those against, please say no. I think the ayes have it.
Mr. President, I beg to move that this bill do now pass and be cited as the Road Traffic Amendment Act 2018.
Mr. President, I call for a divide, please,
On what?
on
Sure,
the
what
road
is
traffic bill and whether or not it should be passed this evening.
on the motion now before us.
Yes, sir.
Yes, I haven't quite put it, but a divide has been called for.
Senator Walker.
Aye.
Senator Moore.
Aye.
Senator McConney. Aye. Senator Dr. Springer. Aye. Senator Grant. Aye. Senator Holder. Senator Cummings. Aye. Senator Haynes. Aye. Senator Sands. Aye. Senator Franklin. Senator Driggs. Senator Driggs. Senator Wiggins. No. Senator Boyce.
Abstain.
Senator Maxwell.
No.
Senator Tate.
No.
Senator Maynard.
Yes.
Senator Nurse. His Honor, Senator Greenwich. 10, 11. President, the results of the division, 11 senators voted in favor of the motion. 5 honorable senators voted against, and 2 honorable senators abstained.
The results of the divide before us, the question is that the bill under consideration do now pass and be so cited. All honourable members in favour, please say aye. Aye. Those against, please say no. I think the ayes have it.
Mr. President, this brings us to the end of our business for today, and I beg to move that the Senate be adjourned until Wednesday, November the 7th.
Question is that the Senate be now adjourned until Wednesday, November the 7th, 2018. All honourable members in favour, please say aye. Those against, please say no. I think the ayes have it.
You do it?
We are now adjourned until
Where's your logo?
November 7th. The Senate now stands adjourned until November 7th, 2018. Thank you.